morning. My name is Dr. Kathleen Kendall-Tackett, and I'm here to talk to you today about the impact of early adverse experiences on children's growth and development. And we're going to look at the relationship between what happens to children during their first 5 years and their later problems with their health as adults. So today's topic is called Adult Disease Prevention Begins with Reducing Early Toxic Stress. And I actually got that title from an article that was published in the Journal of the American Medical Association in 2009. Now, what was interesting about this article is it was looking again at the sort of roots of health disparities, and particularly talking about the impact of early life experiences. Okay, and what they had said is in one of their paragraphs is they said this, that adult disease prevention begins with reducing early toxic stress. And in fact, they went on for this quote, and they said, an increasing amount of research in neuroscience, social epidemiology, and the behavioral sciences suggests that a reduction in the number and severity of early adverse experiences will lead to a decrease in the prevalence of a wide range of health problems. They went on to describe how things like early child rearing and the importance of again, reducing that early toxic stress was responsible, for preventing a lot of illnesses such as heart disease and diabetes and metabolic syndrome. Now, I want to first talk a little bit about, what we know about things like, early life experiences and how they are sort of processed by the brain. Now, in their book on social rejection, which I think was an extremely interesting book, this was published by the American Psychological Association in 2011, the researchers actually described a part of the brain called the anterior cingulate cortex. Now, this is an interesting structure of the brain because if you know anything about the research on pain, physical pain, you will actually find that the anterior cingulate cortex is kind of one of the pain centers of the brain. Now, what we've actually discovered is that social pain is actually experienced the same way as physical pain, and it activates this same part of the brain. Okay, and so in fact what the researchers said is that in fact the separation distress panic system appears to be located in a similar place in the brain, in other words the anterior cingulate cortex, for all mammals, that in fact we are wired to be sort of in groups with each other. And so again, when something happens that interrupts that, such as, that bond between parent and child or parent and baby, that in fact it activates the same part of the brain that is activated when this child or baby experiences physical pain. And in fact, we find that if it's activated in childhood, it in fact increases, their reactivity throughout life. That in fact, these are very damaging and long-term effects, especially if they're severe, especially if they're chronic. Again, like with all of these things. Now, in order to talk a little bit about why early childhood experiences in particular are very toxic in terms of long-term health, it's important that we talk about the stress response. Now, we can think about the stress response in terms of kind of three main components. And again, this is drawing from the literature in the field of psychoneuroimmunology. Okay, but some of this part of the stress response is going to seem very obvious. It's very well known. And other parts are going to be a little less obvious. Now, the first part of the stress response you have to know about is what's known as the catecholamine response. Now, the catecholamine response is, again, the part of the stress response we've known about for the longest. It's been very well documented. It's the fight or flight response. In other words, in response to threat, and that is kind of a key thing. In response to threat, our bodies actually secrete neurotransmitters. Norepinephrine, epinephrine, and dopamine. Okay, and so again, the threat can be physical, the threat can be psychological, but it is something that kicks in instantly, and it's really designed as a protection for us. It's a survival response. Now, another part of the stress response we really started talking about a lot in the mid-90s was something known as the HPA Axis. Now, HPA stands for hypothalamic pituitary adrenal axis, and again, it's a part of the stress response that is designed to protect us. It's designed to increase our survival. And the thing you have to know about the HPA axis is this is where you get the stress hormone cortisol. Again, this is what's known as a cascade response. So it starts in the hypothalamus. In response to threat, the hypothalamus secretes a stress hormone called CRH, which stands for corticotropin-releasing hormone. It is fortunately usually abbreviated in articles, which is a good thing if you have to write about it a lot. CRH then causes the pituitary gland to secrete another stress hormone called ACTH, and that stands for adrenocorticotropin hormone, again, usually abbreviated. Okay, so ACTH then causes the cortex of the adrenal gland to secrete cortisol. Okay, so cortisol, again, is another stress hormone we talked a lot about. We started really noticing, especially in the trauma field, probably in the mid to late 90s. And so oftentimes, articles that were written kind of in that time in the early 2000s, we really were talking a lot about that sort of interplay, particularly between norepinephrine, part of the catecholamine response, and cortisol, part of the HPA response. Now, what was interesting is the psychoneuroimmunology researchers came along and they said, there's one more part to the stress response, and that is the immune response. And the immune system responds to threat or perceived threat by increasing the number of pro-inflammatory cytokines in the plasma. Okay, so these are systemic. This is a systemic response, and so the way that these are measured, these are molecules that increase inflammation. Now, I have sometimes people will ask me, well, what do you mean by inflammation? Does that mean like if I stub my toe and it turns red? Yes, it's actually the same process. But what the psychoneuroimmunology researchers have actually taught us is that, in fact, psychological states actually have a huge impact on the amount of inflammation that we have in our system. And in fact, this system can get upregulated or become activated in the response to threat. Now, with all of these parts of the stress response, they're all meant to be, something that is acute. Okay, and so acute responses. And so in other words, you have a danger, it's over, and then those responses go off. What happens in our modern life, unfortunately, is that these responses tend to be sort of kicked on. And especially if you talk about somebody who is exposed to sort of a severe or overwhelming stressor in the first 5 years of life. Because honestly, that's when our brain is the most vulnerable. It's the most malleable, and in fact, it can actually kind of reshape and rewire the brain. So again, it's very kind of important that, those early life experiences, to the extent that it's possible, not be noxious, not be adverse, not be activating that inflammatory and cytokine and catecholamine response. Okay, so the way that these are measured is actually, you can actually take draw a thing of blood, we can look at plasma, and you can actually get levels of the numbers of these molecules in the system. Okay, so again, psychological states, such as things like depression, hostility, all these things increase inflammation. And so again, if you have sort of an immune system response, and this whole part of the system, the whole stress response system that becomes sort of hyperactive, that's something that can happen with early exposure to toxic stress. And so if you get this sort of hyperactive immune response, then unfortunately what happens is that every time you face a subsequent stressor, you may find yourself being more vulnerable to that sort of inflammatory response system. Okay, so this is what this looks like. You can actually look at some of these different studies here. This was a recent longitudinal study looking at adolescents and young adults. And they were looking actually at an inflammatory molecule called ET1, which is endothelin-1. Now, endothelin-1 is an important molecule because one of the things that it does is it's related to vascular inflammation. Okay, so it actually causes inflammation in the vasculature, and so again, that's going to have a real specific relevance for cardiovascular disease. And if the children or adolescents had reported at least one type of adverse childhood experience, their levels were 18% higher of ET1. Okay, and if they had 2 or more, in fact, it was 24% higher. So again, one of the things that ET1 governs is actually the constriction of those, coronary arteries. And so again, you can kind of see how something that happened in childhood is impacting teens and young adults. Okay, this is another study here looking at, this was a randomized clinical trial. And this is actually showing you, if you intervene in parenting, what kind of difference can it make in terms of health. This is a randomized clinical trial. What was interesting about this is they were working with African-American mothers and their children who were age 11. And so again, I said, it's always, even if families get off to a difficult start, there's always hope. There's always things you can do that are going to make it better. And in this randomized trial, what they did is they actually offered the intervention families just a 7-week course in parenting, just to kind of improve some of the sort of day-to-day interaction. Okay, and the other families just got kind of normal social services that they were getting. Now, when they looked at the children at age 19, what they discovered is that the children of the mothers who'd been in the parenting course had lower levels of inflammation on all 6 measures that they looked at. And again, I said, it really kind of shows you that, it's, first of all, A, not too late, and B, parenting makes a difference. Parenting makes a huge difference if you want to talk about something that's going to improve health. Now, this is another one. This was actually just published last year in the journal Health Psychology, so it was the end of 2013. And what they did is they had a 32-year longitudinal study where they followed 163 people. Okay, so they followed them from birth. They were enrolled at birth, and they looked to them, at various periods of time during the intervention or during the study. Now, one of the things that they did is when the children in the study were 12 to 18 months old, they measured attachment. Now, one of the things to know about attachment is attachment comes from responsive parenting. And so again, one of the things health researchers are starting to look at is it's not just a matter of frank child abuse and neglect that causes the problems. It's sometimes tied up with that day-to-day interaction. Are parents responsive? That's one of the things that really is behind secure attachment in children. Okay, so it's that responsivity. When the children cry, does somebody come? And do children learn, that they can control their environment by, in fact, that there's regular and predictable caregiving. Okay, now what they found, secure attachment made a big difference. Okay, because when they went to age 32, what they discovered was that those who had secure attachments at 12 to 18 months were less likely at age 32 to have inflammation-based diseases. So again, you can kind of see why early parenting makes a difference. And so again, like I said, part of it has to do with that process of that upregulation of that three-part stress system. So with that, I'm going to actually close this module. I just would like to, if you're interested in knowing about psychological trauma, I would recommend taking a look at the American Psychological Association Division of Trauma Psychology. We do have actually affiliate members, and so again, like I said, this is available, and the website for that is apatraumadivision.org. Thank you very much for coming, and I'll see you next time.